Alright, so now we're going to take a look at the medication list feature of the Clinical Nutrition Center patient chart. And you can see again I have our sample patient, Ethan Lazarus, selected. I've changed my view a little bit so the header may look a little bit different. Since I'm logged in as a physician, I have diagnoses and medications listed here because I wanted to show how that integrates with the medication list. Now, medications in the Clinical Nutrition Center patient chart are stored in two areas. The medication list is for patients' long-term medications versus dispensing, which is where we're typically keeping track of the obesity-related medications or the medications we're dispensing from our office. So we can use both lists in a complementary way, but typically the patient's cholesterol medications and blood pressure medications and diabetes medications and so on and so forth will go in medication list, and medications like phentermine, Tenuate, Qsymia, Belviq will go in dispensing. There is some overlap if it's a drug we're using in an off-label way specifically for weight loss, and we may actually put that in dispensing. But right now we're going to go ahead and look at medication list. Of course, you can get there by clicking medication list or by going under the chart sub-tab to medication list. They each take us to this exact same screen. Now if we go down and look at this sample patient's medication list, you can see the patient ID, medication, and show on header indicates whether or not the medication should be listed up here for me. So maybe I don't need to see their acne medication or their eye drops, but these ones I do want to see. So in the medication list I can change that, so I can edit these medications. For example, I could edit Nasacort. I'll just click edit. And I could say no, don't show on header. I could say whether it's an active or not active prescription. Maybe they're not on it anymore because they lost so much weight. But if we click don't show on header, then I'll still have this medication in their medication list. But see, it moves down into the bottom and keeps the show on header medications on top. And up here it's no longer reflected as a medication that I want to see in their chart header. So there's a few things we can do with medications. We can add or grid add. If we just want to add one medication, the patient comes in and tells us they're on something, we can just click add. If they bring in a list and we want to do them all at once, we can grid add. But let's say this sample patient came in and he had been started by his primary care doctor on a new blood pressure pill. Just go ahead and click add, and we can put in the medication name. Let's say he was put on atenolol. And we do want that to show on header, and it is active. So let's just add that as a medication. And you'll see atenolol pops up now up top and down below. Now, of course, another option would be that the physician or medical staff at our center wrote for the atenolol, in which case we may want to be issuing refills or calling it into the pharmacy. So refills is a subtable of the medication list that lets us handle patient refills. So if I go to refills of atenolol, right now there aren't any. It comes up blank. But we can add a refill for this patient. So let's say I'm in with the patient and I want them to get the atenolol. I could indicate the strength. This is 90 and 3 refills. And please call into patient's pharmacy. And then if I'm going to order this, I need to digitally sign it, so I'll put my name and digital signature. Now the bottom 3 fields are very important. Suppose a patient calls in and asks for a refill of their medication. Well, the front office can click Add Refill and can click Refill Requested. And that'll make the prescription pop up in the doctor's box to authorize the refill. In this situation, I've already reviewed the refill and now I want the front to call it in. So if I click on yes on reviewed by MD, but it's not been completed, the front office is going to see pop up in their bin that this refill needs to be called in. So let's go ahead and do that, and I'll show you what I mean. So I've gone ahead and okayed this refill for 20 milligrams of atenolol. And I'm logged in as a physician, but what if we were logged in as the front office? So let's log out here and log in as the front office. And when the front office logs in, they're going to have refill requests. And it says here there's a refill request for Ethan Lazarus for atenolol. And if they click that, you can see in the medication list the atenolol comes up red, so it's easy to see which one a refill request was done on. And the front office can click refills. And here's the refill request, so if they want to fulfill that request, they can click edit to get into the record. And they can go ahead and call it in. And they can click that this has been completed. And when it's completed, now that clears it here out of the refill requests bin so that it no longer needs to be done. Now suppose patient Ethan Lazarus was on the phone and requests a refill on their Nasacort, and the front wanted to ask me to refill that. Well, here's the patient on the phone. He says, can you have Dr. Lazarus refill Nasacort? Or perhaps you got a fax request from the pharmacy for a refill. So you could pull up the chart, go to refills on Strattera, or excuse me, we said Nasacort. Go back here and say Nasacort. And we'll add a refill request for Nasacort. And so if the front got that phone call, refill requested, that we would check yes, because the patient's asking for a refill. And we'll add this as a new refill request. Now I'm going to go ahead and log out of the front and log back in as the doctor. So I click log out. I'll log in as Dr. Lazarus. And when I log in now, I am flagged that I have a refill request for Nasacort for Ethan Lazarus. If I click over, I'll see in red that Nasacort is the prescription that a refill has been requested on. I can get into that table and edit the Nasacort request. Okay, please call in. And I can say that I've reviewed that. And when I edit that, now it's going to clear it out of my box, and this will pop back into the front office's box. So sorry to go back and forth so much, but I do want to show you that. So I'm going to log out, log back in as the front. And you're going to see in refill requests now, here's Ethan Lazarus, the Nasacort. And if you look in there, here it comes up as red, so we know which one we're dealing with. I'll click refills. Go ahead and edit that request. And we could say, okay, called in. And we can mark that as completed. And when we mark that as completed, it's been called in, it's done, and it clears it out of our refill request bin. I'm going to log back in as the doctor one more time, and the remainder of this video is really just for medical personnel, so doctor or physician extenders. And so if you are a front office or other staff, you can go ahead and click stop on this video. If you're a medical provider, watch on for a few more features that I want to demonstrate. So oftentimes we may be working with the patient in the room and want to write prescriptions at the time we're writing our notes. And rather than bounce back and forth, which you can do, that will work, you can actually issue your medication list orders directly from the MD Note. So let me show you that. Those features were added since the MD Note video was created. So now in the MD Notes we have a couple other features on there. So suppose we're working with this patient, Mr. Doughboy, and we're going to go ahead and add a new MD Note. So we're going to leave the first tab alone for now. I just want to demonstrate the second tab. So if you pop back over to the medication tab, remember the top medications, these were for dispensing. So this list has been pre-populated with the different medications we either dispense in our office and use for weight loss. And we're going to save the office dispensing for a separate video because that's a big topic. But down here below that, you can see we've expanded the other medication 1 and other medication 2 tabs so that we can directly add medications and refill requests from within our note. So suppose we're in with this patient and we decide we're going to start them on a blood pressure pill. Let's go ahead and use atenolol again. And let's say we do 20 milligrams, 1 a day, 30 with 12 refills, and we want the front to go ahead and call that in for the patient. And we want to show that on the header. So that's one prescription. These next fields would be for a second prescription. They both work the same. So just to show you some of the logic here, if I click add right now, we'll get an error. I haven't signed this note yet, and I have to sign a note if I'm going to ask for refills on a medication. There needs to be a digital signature on that. So this time, let's go ahead and sign the note. Alright, so after we add the doctor note, first of all, we can see atenolol shows up on the medication list up top. If we move over to the medication list tab, you can see that atenolol has been added to this patient's medication list. And if we look in refills, we can see that a refill has been requested for the medication list. For the medication, it was requested and reviewed but not completed. And it went ahead and put the prescriber and digitally signed it from the doctor note directly. Indicates the medication, strength, refills, and so on. And that prescription will now be showing up in the front office's refill requests bin. And there you have it, a quick look at the medication list features.